Today is the World Cancer Day, and it's a special day for both those who are the stakeholders as well as those patients who are suffering from cancer. Cancer is not one disease. It's a group of more than 200 diseases that share two basic characteristics. One is a non-purposeful persistent growth, and two is a refusal to obey the body's commands. They have the ability to keep on growing and growing, and then they spread with the sole aim of taking over the person's body. Now, who exactly gets cancer? Cancer can be gotten by anybody, any age, any race, any sex, and any cell in the body can have cancer. In our environment, what are the cancers we are seeing today? We are seeing cancer of the breast, cancer of the cervix for women, cancer of the prostate, cancer of the liver, the lymphomas, and cancer of the colon, which is basically the intestines. Those are the cancers we see commonly in this environment.
World Cancer Day is celebrated internationally every 4th of February. The initiative is led by the Union for International Cancer Control, the UICC, to sensitize all individuals in ways to reduce illnesses and deaths caused by cancer.
The truth about cancer is that we don't know what causes it, but what we do know are what we call risk factors. These are certain behaviors that people who have been associated with them, the rates of cancers are found to be higher in them. And it will start from diet, lifestyle, and then certain carcinogens. In diet, there's been things like low fiber has been associated with more cancers. People who take antioxidants have been found to have lesser cancers.
Over the years, the Nigerian health sector has been underfunded and under-equipped, leaving 200 million people with just 80 to 100 oncologists and 3 functional radiotherapy centers for thousands of cancer patients. These patients from the different states in the country only have access to these few facilities and experts made available by the government. Hence, the delay in access to medical care and high fatality rate. The Cancer Center was established by Mrs. Tura Yaradua in 2009. It was created for the poor through fundraising, as her husband was also battling a complicated disease then. She had said, Roots TV visited the center to discover it has been abandoned ever since, with little or no activities expected of such an important place. In an exclusive interview with Dr. Shagaya, a clinical oncologist at the National Hospital Abuja, she explains the early symptoms to look out for in detecting cancer.
200 diseases. It's difficult to say these are the signs of cancer, but we have what we call the caution signs. It spells the word caution, C-A-U-T-I-O-N. The C, that's the beginning of the word. Even if you don't remember all the things I'm going to talk about today, walk away with these 8 caution signs. The C stands for a change in bowel motion. If you notice all of a sudden now you're going to the loo more than normal or less, it's a change. This becomes significant. You should seek help from a professional. A is a sore or a wound anywhere in the body which will not go away. It's something that is significant. See a doctor, and don't just see a doctor and say, I have a sore. Tell them what you're worried about. I had this lecture and I just want to be sure I do. And then they know what to do. The U is an unusual discharge or bleeding, be it from anywhere in the body or any orifice. If it's unusual, it's not a normal monthly cycle. It's not coming at the normal time. It's significant. You go to the loo to pee, you see blood, it's something significant. You go to do number 2 in the loo and you see blood, it's something significant. Your ears, wherever an unusual discharge or blood is coming from, it's something to take seriously. Then the T. The T is a thickness or a lump in the breasts or anywhere else in the body. Please, I tell people all the time, The most important thing is to listen to your body. Many of us will have had the signs, but we underestimate them or we take them for granted. The next letter is I, indigestion. Sometimes people, wake up and they know that when they eat late at night, they have indigestion. These are all telltale signs that you should go for further, investigations. And then the O is an obvious mole or a change in a birthmark. If you have if it starts to itch, starts to bleed, increases in size, or the smoothness over changes, it is something significant. And then the last letter is N, which is for a nagging cough. If you have a cough or a sore throat which is nagging, it's been there persistently, it goes off and on, and then you see it, you take a few medication here, it goes away, it comes back, it becomes persistent, please seek professional help.
According to her, cancer has serious adverse effects on the human body and can be cured if detected at an early stage. But negligence and ignorance have led to the death of many who had the disease.
The females, every month, do your self-breast exam. And every year, go to the doctor and have your yearly annual medical exam. Get your daughters immunized against the HPV, which is will offer over 90% protection from cancer of the cervix. Get your hepatitis B vaccines. This will save you from liver cancer. For the men, once you hit 40 and you're a black male, prostate cancer becomes, something of concern. You want to watch your diet. Weight is of no use, really. It's just unhealthy. Keep your body mass index, within the norm. Exercise 30 minutes, 3 days a week. It's quite sufficient. Eat healthy, fruits and fiber, less of red meat. Smoking, stop smoking. WHO actually says 1/3 of cancers are preventable. Tobacco causes the single most preventable. Tobacco is the single most preventable cause of cancers.
Shagaya further observed that oncologists in Nigeria are being overworked as they attend to patients within and outside the country, since the National Hospital Abuja is one of the few cancer centers available to many in West Africa.
Most of our patients that come in come late. Some of them is because they don't have the information about what I have just talked about. Others is the finances. Cancer care is extremely expensive, so people just shy away. I urge people out there, early detection. There are some cancers that you can treat with just surgery. You might not need to do chemotherapy or radiotherapy just because they were discovered early. We have 2 functioning linear accelerators, which are the machines for radiotherapy. We're lucky because the government has been very supportive. They have been able to provide this for us, but other centers have not been quite as fortunate as we have been. As I speak, there are 2 functioning centers that have linear accelerators. There are about 6 others, but there's one thing or the other not working optimally. Personnel, there are approximately between 80 and 100 clinical oncologists in the country. Remember, we're over 200 million people. So that tells you a lot about personnel-wise. I see patients from all over the country. In fact, I see patients, up to West Africa, Niger, Ghana, all over they come. Because, we are one of the centers. But I tell you, we are overworked, and it would be nice if every center could have something like this. It would reduce the stress on the patients having to travel half across the country.